Hannah, who will start our presentation.
Hi, everyone. Welcome back or welcome for your first week if you're joining for the first time. This week, we're going to be going through the medical piece and just the lack of nutritional education. I'm really excited to go through this and also have our lived experience speaker here to speak to it as well. As a reminder, it will be me and Meredith leading this first 15 to 20 minutes before we go into our lived experience speaker and then questions. I do like to have a disclaimer here that the information in this presentation is not intended to be a substitute for individualized medical or nutrition advice from a medical provider or dietitian. Please, please, please always seek medical and nutrition advice for your specific circumstances as needed. I would also encourage, as like a side note, if you can find like more of like a weight neutral, weight inclusive provider, that is the most ideal. So just a note on language, we've been reviewing this each week, so this may be a review for some of y'all, but just as a reminder, when we're talking about the word fat, when we are using that as a descriptor rather than using it like in a derogatory way, similar to the way that we would say like tall, short, old, young. Other ways this may come up is like person of size, person in larger body. I frequently throughout the presentation will probably say larger or fat, and I really mean this in a neutral tone. No thanks is when we're utilizing fat more in like a derogatory way. Same with the words obese and obesity. These are most commonly used in the medical community. It was created to unfairly and wrongfully pathologize folks that live in higher weight bodies. That's not based in science and can be extremely harmful. I do have a disclaimer specifically for today that the O word will be mentioned a few times throughout the presentation. Please know that this is only in relation to the research studies I've sourced and direct quotes from those, and not from a place that I or ERCP is describing folks that live in larger or fat bodies. If you're unaware, what does pathologize mean? I like to remind folks it means to unfairly or wrongly consider something or someone as a problem, especially a medical problem. So again, we're seeing this mostly in the medical community, but in other spaces as well. So we continue to move through our cycle of socialization. So this cycle maps out the different spaces in our lives of how we learn and where we learn it. In the first week, we discussed our first socialization from our family units, then our community and education systems, specifically when we were looking at grade ages like K through 12, and then intersectionality. Today, we're going to be putting our focus to medicine and the medical system specifically. Before we do that, I want to do a little nutrition true or false to get us started off. So with each of these, you can just put in the chat if you think it's true or false or not. So first we have is you shouldn't eat after 6 p.m. True or false? What do we think? Seeing lots of falses come in very quickly. False. Thanks, Oprah. False. So yes, you're correct. False. The time you eat has no effect on weight gain. Some people we do see sometimes will overeat between dinner and bedtime, and this is often linked to under eating during the day. So the only reason a person could experience possibly weight gain from eating at this time is because of the energy. When I say energy, I mean calories. I'm just like not a big fan of the word calories. Energy consumed in an excess over a period of time, not because your body doesn't process them in the same way. So that is false. The next one we have is true or false, carbohydrates always cause weight gain. Those are coming in fast. The F word, that's so funny. False, false. Yes, you're correct. Carbohydrates are, I definitely included this one in here. Carbohydrates over the last like 3 to 5 years have been really, really demonized. So I wanted to put some focus towards this. So carbohydrates don't cause your body to make or store fat. So eating excess energy or calories over a period of time from any source, whether that's protein, carbs, or fats, may cause weight gain, doesn't necessarily mean it will. Glucose is converted to body fat. Glucose is converted to body fat only if you consume more calories than your actual body needs. And then just some fun facts about carbs because they are so demonized. So carbohydrates are broken down by the digestive system into glucose, which is the body's main source of fuel. Carbohydrates are actually the body's most efficient source of energy. Glucose is the preferred fuel source for the brain and is needed for our central nervous system. So things like our kidneys, muscles, including our heart, and to function properly. So our brain really functions most efficiently off of carbohydrates and glucose. And then lastly, adequate intake of carbohydrates prevent the body from breaking down muscle for energy, otherwise known as the protein sparing effect. I probably could go through another 30 minutes of why I think carbs are so amazing, all the amazing things they do for our body, but just a reminder for today. And then our last one, true or false? Serving sizes on nutrition labels reflect the amount of food you should eat. I like the person that put like 5 Fs. Yes. So, serving sizes I think can be really, really confusing. And a lot of folks are looking to this as a guide to how to nourish themselves. So the USDA standardized serving sizes in 1993. This is also known as the RACCs, which is reference amounts customarily consumed. These were actually based on surveys from 1977 to 1987. So yes, we are still using data from 30 to plus 40 years ago, which I like to call out. On how much consumers typically eat of each food. Recent data, however, is showing that serving sizes in many foods are too small. So what's not taken into consideration is of the standardization also is individual energy needs. Each body is different. Each body is unique. Each body will require a different amount of energy day to day to survive and just ultimately thrive. So why am I spending time on this? I just think there is so much conflicting nutrition information out there, and these are just a few of the common ones that we see. And because there's so much out there, it gets really confusing to understand what maybe is factual, not factual, and how do I nourish myself for my own individual needs and possibly like health conditions and things like that. So getting into scope of practice, we're going to focus this towards a registered dietitian and a quote unquote nutritionist specifically. So a registered dietitian, you may see them go by RD or RDN, has a 4-year bachelor's or master's degree in dietetics with a 1-year dietetic internship that mandates at least 1,200 plus supervision hours. Actually, of January 1st of this year, a master's degree will now be required to become a dietitian. So more education is now being required. Our nutritionist has no mandated requirements with little to no education or accreditation and cannot provide medical nutrition therapy. While an RD has to pass a national exam, obtain 75 hours of continuing education every 5 years, and can provide medical nutrition therapy. So in general, medical providers have a very small amount of nutrition education, yet are very, very frequently making generalized recommendations related to food and nutrition for patients that often at times are unhelpful and even harmful, specifically to folks that live in larger or fat bodies and or folks that are living with an eating disorder or just disordered eating patterns in general. We're all impacted by diet culture in some way. We're also going to be talking about media and social media in the next few weeks. So we'll be seeing a lot of nutritionists. You'll see me do this a lot of quote unquote nutritionists in media and social media specifically. These influencers are very frequently trying to sell you products, meal plans when they don't have the same education as possibly like a dietitian does. So moving more into like healthcare and informed consent. So we really can't talk about healthcare without talking about informed consent. So what is it and why is it important? So informed consent to a medical treatment is going to be a fundamental in both ethics and law. Patients have the right to receive information and ask questions about recommended treatment so that they can make well-considered decisions about their care. So that is actually direct language quoted from the AMAs, which is the American Medical Association's medical code of ethics. Informed consent is going to include things like the diagnosis, nature and purpose of recommendations, benefits, risks, alternate treatment, ability to understand. So for this one, essentially, what is the patient's ability to understand and grasp what is this the diagnosis is and what are the recommendations that are being made by the medical provider. Another one that's not on here, but something we also need to consider is the option of doing nothing, right? Somebody can get a medical diagnosis and decide to not take any steps or take any recommendations that medical provider is making. And that is up to that patient, right? That's that informed consent piece. So where informed consent at times, I shouldn't say at times, very frequently, it tends to be lacking is when the conversation is related to body weight and recommendations to weight loss. This happens very, very frequently. I can tell you just from my own experience of living in a larger fat body and going to my own medical providers, but also for my patients that I work with consistently as well. I'm going to pass the mic over to Meredith for the next few slides.
Thanks, Hannah. So as we're talking about informed consent and just generally navigating healthcare in recovery or in the pursuit of recovery, it's really important to talk about what that might look like. I have a lot of patients who come into my office and are like, I don't know how to go to the doctor in recovery and not be, spiraling about being weighed, or what if I go home for the holidays and my family is bringing up things that I'm not ready to talk about, and how can I have these conversations about health that are aligned with my recovery goals and kind of with the way that I'm living my life in recovery. So, in terms of setting health goals in recovery, some things to be mindful of. It's really helpful to focus on mental, emotional, and relational well-being. So, if you think back to the social determinants of health that we discussed in week 3, what can you improve? What do you not have control over? Can you kind of zoom out and look at it from that lens of intersectionality that we spent so much time discussing, and think about setting goals that are not just health goals, but that are holistic life goals, and that can help you improve health in every sense of the word, and not simply in a medical sense of the word, or a body size sense of the word, which we know is not realistic. I think other things that are helpful here are considering your relationships with food and exercise. Are they balanced? Are they intuitive? Do you need more support with exercise than you do with food? Do you need more support with food than you do with exercise? Who can you reach out to for support on those specific things? I think it's also very important to strive for body tolerance. And I'm going to shout out to our week 3 lived experience speaker, Nia Patterson, for coining that term. Striving for body tolerance, body neutrality, or body acceptance, whatever feels most resonant for you, and whatever is going to fit into your life, or wherever you feel like you are right now. And that might change later, but trying to find some form of collusion with your body, whether that is, I'm going to tolerate you, I'm going to feel neutral about you and care for you, or I'm going to accept you, or maybe one day, if it feels like it fits for you, I might feel positively about you. As well, planning coping strategies for when difficult feelings related to health or the pursuit of health pop up. So when you know you're going to have a tough conversation with somebody, you have a doctor's appointment coming up, just kind of knowing ahead of time what you're going to need. For me, oftentimes that is my spouse coming, and sometimes in the room with me, sometimes in the waiting room, sometimes in the car. But knowing that I have my spouse with me is really helpful, and knowing that I have someone to co-regulate with if it doesn't go the way that I want it to go. When you're discussing health with family and friends in recovery, it's really important to know your playing field and prepare as needed. So just going into the situation, knowing that your typical family rules and dynamics and patterns are always going to be at play, like we talked about in week 1. And so how and when will you know that you need to access support? What's going to come up in your body? Is it my face is starting to flush, or I'm starting to get really hot, or I can feel myself getting overwhelmed and I need to reach out for support? How am I going to do that? Thinking ahead of time. You can also choose to educate family and friends and share your experience if you feel that there's empathy and room for compassion in these relationships. That is not always the case for everyone, which is incredibly heartbreaking and frustrating. And so it's also important to know that if there is not room for empathy and compassion and understanding, genuine willingness to understand in those conversations, you don't have to engage. You don't have to discuss your health with anyone. You can just set a boundary with them, leave the room, decline to discuss that, change the subject. You can also engage with professional support. This is a great place to bring in a therapist or a dietitian to get some family education going, and kind of have somebody on your team who really understands what's happening. From a healthcare advocacy point of view, if you're going into the doctor's office and you're preparing to have conversations about your health, and you know that potentially your body size is going to be drawn into that, as it often always is if you're in a larger body, whether or not it's relevant. It's really important to consider how you're going to enforce weight neutral care with your provider. So discussing with your treatment team or your family, whoever your support people are, to define your preferences ahead of time. Am I going to go in and ask for a blind weight? Am I going to go in and refuse to be weighed? Am I going to stay clothed instead of putting on a gown? What is going to make this a safer experience for me? And in the vein of everything I've been saying, planning ahead. Do you need a support person? Do you need to bring a gown that you know fits you into the room to feel more comfortable? Do you want to make accommodation requests ahead of time? Do you want to do that with a phone call, or do you want to do it in writing? And kind of thinking about what you need to feel most safe in that conversation. It's also a good idea to consider bringing conversation supports or tools. ERC has some medical care cards that I believe Emma and Kaylee have linked before. Maybe one of you can link them again if you hear me. And as well, Reagan Chastain has some great cards that you can print and take to your doctor that have research cited on the back. And you can let those do the talking for you. You can also just come and give your expectations of how you want your medical care to go. So whenever I've had to get a new doctor, I have the conversation of, you are my medical provider now. This is what I expect from you. I expect for us to have respectful conversation. I expect for you to listen to the things that I'm saying, my preferences, needs, and wants. I expect for you to engage in Q&A time with me when I'm making a medical decision with your input, education, and support. Setting those boundaries ahead of time for how this visit's going to go and what is to be expected, because at the end of the day, you are receiving a service. Healthcare is a service, and we're made to believe that, this power differential of the physicians have all the power or the provider has all the power. And it really throws off the way that those interactions go, because oftentimes people who are in the patient seat feel that they can't advocate for themselves because they don't have enough power in the room. So taking your power back and knowing that this is a service that is being provided to you, and you as someone receiving a service have a right to receive service and care that is respectful and educated, and that meets your needs in all ways. You can do this as well. I think it's important to mention if for example, like they won't order a test that you'd like ordered, or they're kind of stopping the conversation at, you should try losing weight for this ailment instead of considering other tests, other options, other treatments. Asking them to document their refusal in your chart is really important, right? So if you're not getting the care you need, ask them to document that. It's also important too, I want to put a positive spin on this, that there are many great doctors out there who simply need a little education or a reminder of what your expectations are of them. And then you can move into collaborating on treatment goals, finding ways to connect your values and preferences with your medical provider's recommendations, and working to remove the stigma out of kind of those casual weight loss recommendations or casual, ascriptions of ailment to being in a higher body. It's also a really important thing to remember that you can and should always seek a second opinion if your care does not feel adequate or aligned with your values. You can always go somewhere else. You can always ask for a second opinion, and it should feel like you're leaving the office having been heard, and that you were able to receive the information that you needed, ask the questions that you wanted to ask, and that you have all the information that you need to make a decision that is best for you. And then Hannah, if you'll scoot me forward a slide, thanks. So I dropped some tips here for finding a weight inclusive provider. Some things that you can do, there are links here that you can visit, or places that will have listings of weight inclusive providers. The other thing to do is, if you're like, maybe I'm in a rural area, there's not a lot of people around me, I don't really know, how to find someone who does this where I live. Things that you can do for just a general provider you're going to see, pay attention to the language that's used when they're talking about weight and body size or on their website. This should be neutral and respectful language. They should communicate in a non-judgmental and compassionate way. They should create an environment that makes you feel safe. Seek providers who demonstrate an understanding and appreciation for body diversity. When you walk in the waiting room, is there a place for you to sit that is friendly to your body? Diversity in their marketing materials, their website, things like that. Discussing various health markers and indicators beyond weight. So talking about things like blood pressure, blood sugar levels, cholesterol, cardiovascular fitness, all these different things that are not arguably are just more important for health than weight is. And someone who's asking you about like, how are things going at home? What about your emotional health? Are you like leaving your house and interacting with other people? Do you have a job that you enjoy? Do you have access to food? Someone who's looking at the full spectrum, and someone who involves you in the decision-making process regarding your care. Instead of saying, this is what we're going to do, they say, here are some options. Let's talk about them. And that is really helpful when you are looking for someone who's going to meet your needs. And yes, I'll put the links in the chat, of course. I'm going to pass it back to Hannah.
Thanks so much, Mare. I feel like empowered after listening to you. I'm like, yeah, I am. I can do this. I think I needed to hear that today. So thank you for empowering me. I'm now going to move into the impacts of weight stigma and anti-fat bias. Okay, I want to say I will be saying the O word here, reading it from a research study. I have 3 total. I just want to show that not only are we like experiencing this if you live in a larger fat body, but we have research that supports that this is happening to people. So first, for this first one, we have that many healthcare providers hold strong negative attitudes and stereotypes about people with obesity. There is a considerable evidence that such attitudes influence person perceptions, judgment, interpersonal behavior, and decision-making. These attitudes may impact the care they provide. We know that many medical providers hold negative beliefs for folks that live in larger fat bodies. And because of this, we know that this is going to impact the care that they provide to these folks on a day-to-day basis. For the next one here, we have experiences or expectations for poor treatment may cause stress and avoidance of care, mistrust of doctors, and poor adherence among patients with obesity. Stigma can reduce the quality of care for patients with obesity, despite the best intentions of healthcare providers to provide high quality care. So what I like about this article is that it points out even if the provider has the best intentions, stigma can still and will reduce quality of care and impact the patient in general. When folks are experiencing discrimination for living in a larger or fat body, it creates that mistrust, and it may result in them not coming back for follow-up care or delaying, right, things that are coming up for them that could be significant. So an example of how we may see this is we have a person that lives in a larger or fat body and they present to their primary care physician's office for example, maybe GI symptoms. So maybe they've been experiencing nausea, vomiting, diarrhea, or constipation, or even just presenting for something like the flu, strep, or a cold. They are often met with recommendations that they just need to lose weight. That's their problem. That's why they have this ailment. It's a you thing that why you're experiencing these GI symptoms, or it's a you thing that you have the flu right now. So actually that's not what they came in for their appointment, right? And that these symptoms that they came in to be addressed were attributed to their body size that they live in. So what happens is diagnoses, conditions, and/or referrals to a specialist can be missed completely or delayed due to this type of bias and stigmatization. For some conditions, it may not be as harmful, but if we have somebody coming in and they're having these GI symptoms and they have colon cancer and they're met with, you just need to lose weight, that's going to delay them to probably maybe life-saving measures. And this is happening. We are seeing people coming out and speaking about their stories and what they've experienced. So this is really significant. I could probably talk about this for like the rest of today, but I'll hold myself back because I really want to hear from our lived experience speaker about some of this stuff, but just seeing that we're seeing this in the research as well. The last one I want to call out is this last one. So consistent with analyses, several studies have shown that disease framing often exacerbates anti-fat bias. For example, found that participants who read news articles that described fatness as a public health crisis expressed more negative attitudes towards people. So towards fat people. So judging them for being unattractive or deeming them as lazy compared to those who read an article about another health condition. So I like to call out that in 2014, the AMA, the American Medical Association, classified quote unquote obesity as a disease. This article specifically is expressing that prejudice that people that are living in larger fat bodies will not only experience now from their medical community and medical providers, but now they're experiencing it from their peers, their friends, and their families because this was declared as a public health crisis. And I just think of stress and cortisol and overall health. So now that they're not just getting it from when they go to the doctor's office, they're also getting it in their other communities. And they probably were already experiencing it in some shape or form via like bullying or something. I'm not going to say much here, but pharmaceutical companies are a huge influence on our medical community. It's not a secret that a leading goal for pharmaceutical companies is a profit, like many companies in the systems that we live in. Historically and currently, we can see this in the opioid crisis and pain management in the US, if we were to compare it to something. We now see this significantly for weight loss, weight management via medications like these GLP-1 agonists. So I won't go into more detail here. I do have some quotes here from an article that I pulled from, but just really understanding that pharmaceutical companies have an incredible impact on our medical system and how our medical providers approach the care that they're giving. Lastly, just talking about informed consent and weight stigma. So can we get curious? So this is an example. This is one of the most talked about medication classes, I would say, since probably Viagra. And I'd be doing us a total disservice by not talking about these medications because they're so prevalent in the medical community and beyond, which we'll see in the next few weeks in media and social media. There are people that are prescribing and people that are taking these medications that should not be, and there are people that should be. So let's just really have a nuanced conversation around this. I want to be very, very clear that we are not recommending not taking or taking these medications. How you make your medical decisions is between you and your medical provider. What's most important to me is that you have informed consent when making these decisions and knowing what questions to actually ask your healthcare providers. So for example, when I'm talking about, I'm using GLPs as an example here. So GLP-1s, if that stands for glucagon-like peptide 1s, are somewhat of a newer class of medications, I would say in the last about 10-ish years. Medications that contain GLP-1s that you're probably most familiar with hearing about include like Ozempic, Wegovy, etc. So these medications really help in stimulating insulin secretion and inhibiting glucagon secretion, which has then been found to help improve blood glucose levels and lower overall hemoglobin A1C levels. If you don't know what hemoglobin A1C is, that's basically your average blood glucose level over like a 3-month period of time. So these medications have been seen to also promote early satiety by slowing gastric emptying to promote fullness sooner. Common side effects have included things like nausea, vomiting, diarrhea, constipation, fatigue, headaches, dizziness, and weight loss. In more serious cases, there have been reports of things like bowel obstructions, acute kidney injury related to that nausea and diarrhea, acute pancreatitis, and some folks developing gallstones. These medications primarily really were created and utilized for folks with type 2 diabetes. When folks started to take these medications for their diabetes, it was found that many were losing weight. And due to this, pharmaceutical companies really jumped on that and started to increase that dosage and rapidly began to promote to medical providers to treat the O word via weight loss. Ozempic and Wegovy are the same drug, actually. They are just a different dosage. So I think there is some confusion around that. Ozempic is prescribed for diabetes diagnosis, while Wegovy is prescribed for a weight loss, and it's prescribed at a higher dosage. With the higher doses, we are seeing more side effects and an increase in overdoses of the actual medication. So like Poison Control is getting more calls about this. Weight stigma in the medical community is just so prevalent. And this is where we're seeing that weight loss at any cost from diet culture really seeping into medical care that we receive. There's really no evidence on long-term research yet for folks that do not have diabetes that are taking these medications. We don't know what the impact on the pancreas and the body will be in the long term for folks that have a fully functioning pancreas or don't have that diagnosis of diabetes. So we just don't know yet. So really bringing this back to informed consent. So if your doctor or healthcare provider is trying to prescribe these medications to you, here are some questions that you can ask them. So why are you prescribing this medication? What's the reason? Are there other medications available to treat my condition or diagnosis? If you do live in a larger or fat body, what would your recommendation be for someone in a smaller body or a straight-sized body that's experiencing either these same symptoms or diagnosis? If you're exploring weight loss with your provider, asking what's the long-term trajectory of this? How long will I need to take this medication? What's the likelihood of the weight gain and weight gain in the future and what the time frame looks like? Could I experience weight cycling with this? These are not just questions that you can ask for GLP-1s. You can also ask these questions when your medical provider is requesting any type of test or recommending any type of medication, or if they're just recommending weight loss in general. So really wanting you to feel informed and empowered to ask these questions when you're in these appointments with your providers. Wow, that was a mouthful. Thanks for hanging in there with me. While we're speaking all into this, I'm actually going to now transition into our lived experience speaker, which is Sharon Maxwell, pronouns she, they. Sharon is a mental health advocate and fat activist. She works as a weight inclusive consultant, providing education to treatment centers and healthcare providers on the immense harms of weight stigma. Due to her lived experience facing weight stigma, Sharon provides unique insight and offers practical tools to treatment centers and healthcare settings safe and accessible for fat folks. So with that, I'm going to hand it over to Sharon. We're really excited to have you here today.
Thank you so much, Hannah. And also thank you, Meredith, for all of the incredible information you just provided us. And I just wanted to pause for a moment with everyone here, especially for those of you who are here living with lived experience of facing weight stigma in healthcare, and just acknowledge how dehumanizing and traumatizing all of this is. And the fact of the matter is, all of us deserve and need to receive healthcare. And so obviously we're providing you tools and things like that, but the harsh reality is this comes at a great cost for us to put ourselves in a position where we then go to the doctor, right, and try to receive that care that we deserve. And we shouldn't have to beg for it. It should already be there. However, this is the state of the society we're in. So let's dive into, I want to tell you a little bit about my lived experience. And I want to let you know that when I talk about any weight stigma or trauma that I face in the medical setting, I will raise my hand the entire time I'm speaking about something that may be considered traumatic. So if that's hard for you to hear, you can turn your sound down and I'll put my hand down once I finish describing that exact experience, just to make sure that anyone currently who is watching can have that disclaimer. I was born in a fat body. I've been fat my entire life. And since a young girl, that was the focus of what my quote unquote health would be shrinking my body. And an example of this is when I was just in the 3rd grade, and I'm going to raise my hand now for anyone else who might be listening and not watching. When I was in the 3rd grade, I had recurrent bouts of tonsillitis. And there was another girl in my class who lived in a thin body who also had recurrent bouts of tonsillitis. And she, after a few bouts, got her tonsils removed. It's an easy surgery and one that happens often for children who go through this. However, when I went to the doctor with my mom, my doctor looked at me and looked at my mom and told my mom that if I would not be having these recurrent bouts of tonsillitis if I lived in a thinner body, and that my body size was impacting the reason why I was getting ill so often. And we know that's absurd, right? I'm putting my hand down now. Tonsillitis happens to folks in all sizes, just as there is no medical condition out there that only fat people get, or that only thin people get. So fast forward to from age 8, I'm going to put my hand back up now, to age 23. And I went through bouts of tonsillitis every 3 to 4 months. And what that meant was I was on antibiotics. My body had that many rounds of antibiotics from age 8 to age 23 in order to treat the constant recurrent bouts. And what ended up happening was each time I had tonsillitis, my tonsils never fully went back to their original size. And when they got well, they were always just a little bit bigger. And then as an adult, I started making the joke that my tonsils were the size of Texas and California combined when they were not infected, just hanging out in the back of my throat. But at age 23, I got another bout of tonsillitis, but that time it closed my airway off. And so much so that if I had not been around people that day who rushed me to emergent services where I was hospitalized for 8 days, I would have died because doctors saw my size instead of seeing the need that I had medically speaking. I'm going to put my hand down now. That is just one story of countless tales that I could tell you of weight stigma that I experienced while going through our medical system. And the advice that these doctors would give furthered and encouraged the eating disorder that I had developed around age 7 and just simply made it worse. And if you are living with lived experience, you may also have had the experience where my hand's going up again, where a doctor looks directly at my body and doesn't ask me what my behaviors are around food, what my behaviors are around movement, but rather prescribes weight loss. I'm putting my hand down. And so that is something that instead that looking at my body and prescribing weight loss and rather encouraging my eating disorder made my eating disorder get more and more severe, where I went 19 years undiagnosed and untreated with an eating disorder. And in those 19 years, I had 10 years of amenorrhea where I didn't have a period. But doctors again looked at my body size and said, well, you're not having a period because of your body size. And that 10 years of amenorrhea led to this last October, the need for a hysterectomy. And so weight stigma ultimately sterilized me. And so the impacts of weight stigma, I'm not telling anyone a secret, right? It is so devastating on ourselves individually and then also like collectively. And it is a massive trauma that we, the medical trauma is so huge, especially for those living in larger bodies and also those living in Black bodies, and they're taken less seriously as well. And so I know I hold a lot of privilege as a white person speaking to this. And I say all of this, and yet there was a doctor in Arizona that I met with, and when I was 26 years old, and she saw me and saw me, didn't see my size, but she saw me as a human. And she didn't know what quote unquote health at every size was. She had never heard that term before, but rather she was a doctor who practiced medicine well and practiced from an aspect of not doing harm. And when I went in to see her, I went in expecting and anticipating that I would walk in and I don't know about anyone else here, but I kind of walked into doctor's offices with my hands wide open, anticipating that I would receive shame and that I would receive being told that my body is wrong and that I needed to lose weight. And I kind of prepared myself like, yes, I do. And I almost like anticipated and expected and almost invited the shame that would come at doctor's offices, right? Like, I deserve to hear this because I'm a fat person. And I walked in with that anticipation that I would receive shame, but I was met with care. And it was shocking, so much so that when my doctor told me she thought I had an eating disorder, I laughed in her face. And I told her that she was absolutely bonkers. And she sent me home to then look at some screening tools online and to kind of digest the information she had given me. But she in that appointment asked me, what are your behaviors around food? What are your behaviors around movement? Asked me specific questions about behaviors I might have been engaging in. And I answered her honestly and fearfully. I'd never disclosed these things about myself to anyone. It was my secret, and doctors were supposed to be able to continue to tell me to further these behaviors, right? But that doctor saw me that day, and I have her contact information to this day, and I message her on occasion, and it's been really beautiful to be able to thank her for ultimately being the person that helped save my life, and helped me get on the track to get eating disorder care. And it's not been a smooth road since then, though. I still have faced big bouts of discrimination in healthcare settings. And in fact, I currently live in San Diego, and there's a doctor that most eating disorder treatment centers out here or eating disorder therapists, etc., will send folks to this doctor. They are marketed as a quote health at every size provider. However, they have provided extremely harmful care. And it's interesting, though, because I now feel, and not just feel, I now know the kind of care that I deserve, the kind of care that I should be receiving. And so I don't accept the harmful care any longer. And I say that with the also the caveat that when I do receive harmful care, it still impacts me. It's still very challenging. And I still have to do a lot of things to take intentionally care for myself post receiving harmful care. But, and I saw someone, and I don't remember who it was, but commented earlier in the chat that you are something along the lines of like, you are the boss of you. And I love that, because something that I was planning on telling you today is that you are the expert on your body. The doctor does not have authority over you. And even if you have experienced, especially if you have experienced harm at the doctor's office or at the hands of healthcare providers, I want you to walk away from this call, this conversation, hearing that you are the expert on your body. That doctor is not. We are the ones the longest relationship we'll ever have is the relationship we have with ourselves and with our body, right? I know what's happening in my body. When I go in to see a doctor, I meet with them for what? Sometimes as short as 90 seconds, and sometimes maybe as long or as generous as 30 minutes. But typically it's not much longer than that. And they get this itty bitty snippet, right, of what we tell them that's also given with probably a lot of anxiety, especially for those of us who face medical trauma, right? And so they're not the authority or expert on my body. I, Sharon Maxwell, am the expert and the authority on my body. And if what they offer me does not work for me, I do not receive that. I do not have to receive that. And it was talked about how you can go get other doctors and second and third and fourth opinions. And I totally recommend that. And I also know that sometimes that comes with privilege, and that's not something that's accessible to everyone. And so what I want to also offer is that just because a doctor says it's so doesn't mean you have to, like, again, accept that. And in that conversation, and I think it was Meredith that said that you can ask, like, what would they offer your thin counterpart? There are ways to advocate to your doctor and ask them to give you care that is not harmful. And something that I did with my doctor out here in San Diego, the one who claims to be a health at every size physician, however, is absolutely not. I had a conversation with this doctor, and I first asked if they knew that they were marketed as a health at every size clinician, because the advice they were giving me was absolutely harmful and stigmatizing towards my body. And it was interesting because their response is, oh yeah, of course I'm a healthy at every size provider. Like, they didn't even understand or fully know the term. And so, which is just neither here, it is actually relevant, but it gave me more insight into how little they actually knew. And I asked them what that meant, and they said, well, Sharon, I'm not going to judge you because of your size, right? Okay, so you can say you're not going to quote unquote judge me, but that does not actually, that's not showing up in the way you're giving me care, right? So we had this entire conversation, and I told my doctor, I said, you know what, I don't blame you, and I really do think that you want to provide me care that where you don't cause harm, right? Like, they take their oath, do no harm. And I believe that my doctor has those intentions. And I said, but the reality is that doctors, for the most part in medical school, are not trained how to treat me, a person living in a fat body. Rather, they are trained to treat the body size. And so when they look at my body, they're like, okay, we need to shrink it. And that's going to like improve all of these different health markers. And so when I talked to my doctor about the fact that like, I want you to, even if you don't know, and even if you weren't educated in the ways to treat my body without harm, I want you to go out there and find out how you can. As my doctor, as my provider, I need you to do the work to figure out what we can do to provide care for this medical issue that I have going on without asking me to intentionally shrink my body size. There were a lot of tips that were offered by both Hannah and Meredith, and I have a few that I wanted to offer as well. I like to say that I was born with a fistful of hope, and I've just walked through life as such. And so I saw the comment, cat love. Yeah, my cat made a little cameo appearance. Sorry about that. She's adorable. But there's so much harm in the medical field, and yet there is so much hope that we can have. I believe there is hope that we can advocate for ourselves and receive the care that we deserve. And so a few things that I recommend, which some of these might like reiterating what you've already heard a little bit from Hannah and Meredith, but I always plan what I'm going to say before I go, because in the medical offices I have experienced trauma there. Sometimes it's hard for me to get words out. Sometimes that freeze factor in a trauma response will come on where I just get stuck, right? So I'll write it out. And I'll also either take a friend with me physically or virtually and have someone on FaceTime or live on the phone with me. And I will let that person in, that trusted individual, know, hey, these are the things I want to talk about. And if the doctor doesn't answer this, or the doctor, whatever, can you help me revisit this in the conversation? Because again, sometimes I might be in a trauma response, especially if they are attacking my body, right? So someone else who might be a little more grounded in the situation can help me then advocate for my needs. And then I remind myself over and over and over and over that I am the expert on my body, not that doctor. And then the other thing is that before I go into the office, I intentionally, and I always cringe when people tell me to do this, but I actually practice like taking really big, deep breaths. And I know when you hear it, you're like, whatever, or at least I am, but it actually does help. And so if you're ever in the place where you're rolling your eyes, also roll your eyes while you're taking a deep breath, right? But doing that, and then reminding yourself, post or pre an appointment, that weight stigma is actually not a you problem. It's a problem of the system of oppression that we live in, the society that we live in, and the fact that anti-fat bias is so deeply woven into the fabric of our society that it's like the air that we breathe, right? So this is not actually a you problem, if that's helpful for you to remember. And then the other thing is that you have agency. You don't have to put yourself through an appointment where someone is being harmful to you. You can walk out. This is a service, as it was said earlier, that's being provided to you, and you don't have to put yourself through it. Leaning into supports. And then also the other thing that's really I've had to work on is that if I've received harmful care, it takes me a long time to go back to the doctor, but that can often make the health problems become worse. And so I really try to press into my supports and repeat the cycle of listening what I want, getting a support person, grounding myself, all of these different things that I mentioned, and not allow myself to delay in a very long period of time about finding the next provider that I'm going to go to, if you are an individual who has the ability to be able to find another provider. So again, I think I've gone a teeny bit over 15 minutes, but I wanted to say, first of all, I'm holding so much compassion for every single individual here and listening to this later who has experienced harm like this. And I also am holding so much hope that we can receive the health care that we deserve. And you are your best advocate, and you, my friend, are the expert on your body.
Thank you so much, Sharon. And thank you also to Meredith and Hannah. I know that this is probably one of our most anticipated sessions that we had coming up. I know that we've gotten questions throughout the other weeks regarding to medical things. So I'm really grateful for all of you to be here. Excuse me. I just wanted to quickly say, for those who maybe weren't able to access the chat, or I know that some people struggle with chat and technology. someone had asked about questions of where to buy a good quality one in larger sizes. And Meredith replied that you can get them on Amazon up to a size 5XL. And for any additional sizes, you can find them online. Unfortunately, as an FYI, they are classified with very pathologizing bariatric hospital gown, but you can find them elsewhere with that term. So just wanted to let y'all know that that is an option for y'all to look into. Someone also asked about cheat sheets on questions that we can ask. And I think I replied in the chat, or I can't remember, but I just wanted to let you all know that we will be sending out some of the questions that were asked during this session out to y'all afterwards. And then there was a question about how to do something versus not doing something, and this kind of struggle between figuring out whether or not to do that. And I replied in the chat that we encourage discussing with a weight-inclusive therapist, dietitian, or a trusted loved one prior to appointments. Also going to support groups, and I listed a ton of free support groups that will also be included in our follow-up. As support groups can be a really amazing place to find community and connection with others who might be going through similar experiences to you, and they might be able to provide some, something that has worked for them, or just kind of those tips and tricks that I feel like sometimes you just kind of find from one-off situations that someone has gone through. One of the questions actually was for you, Sharon, about how they live in Arizona. Any chance you could share the doctor's name? And
unfortunately, this doctor is no longer practicing in Arizona. So I'm super sorry to share that.
Yeah. But the resources that Meredith shared on her slide and then also in the chat are also a great place to find hopefully local resources near you. And then, so this question is open to anyone, but someone had asked, I feel like the treatment atmosphere is trying to move more towards a HAES-based approach, but still require people to be weighed. What's an explanation for that?
I'll take this one or chime in. So I think the goal of weight inclusive care that includes weighing folks is really to track weight change. And I'm speaking purely from an eating disorder treatment program lens. Weight change can potentially indicate medical issues. So someone's stable weight, regardless of what that number is not indicative of any health concerns by itself. But if we're seeing like lots of rapid change in either direction, or like change down and then change up, sometimes that can mean there's something going on in your body, and also sometimes not. And so that's why it's important for us to really take a look at the full picture. So in a weight inclusive care program, we will weigh eating disorder patients to track weight change, but that's one of many, many, many markers that we're looking at. So we also want to take your vitals. We want to see lab work. We want to talk to your registered dietitian. We want to hear your clinical story. We want to fully understand the whole picture to see what might be going on with you. So tracking weight change is important just to check in and evaluate if there could be other things going on. And also, I always will say it is not even close to the most important thing that we look at, and weight by itself does not indicate anything to me. Like if I'm, seeing a weight for a patient, I'm not going, oh, this person must have this eating disorder, or this person must have this going on. Like we really have to see all of those different data points and see what story they could potentially tell, and we really need all of it to make the full picture. So I don't know if that's helpful or if anybody else has thoughts.
I'd like to jump in if it's okay. I know that I really struggled with this component because in treatment centers, I was told, refuse weights at your doctor. But then I was told, you have to stand on the scale here. And I was like, well, I'm refusing weights here. And it was a non-negotiable there. And so and with weight being something that has been weaponized against me so much as a person living in a larger body, I do personally have issue with it. However, I understand that treatment centers have specific things you have to do, etc. And so I hear that it, for folks living out there that like what Meredith is saying, we're not looking at it in a judgmental way, all of those things. And it is like if there's going to be a safe place to get weighed, it's going to be hopefully an eating disorder treatment center, right? But I also want to just validate the incongruence there, because I definitely experienced that. And it was a big point of something that I discussed a lot with my treatment team while in eating disorder treatment. And I also I would encourage those of you who are experiencing that to go specifically to your therapist, dietitian, your individual one, if you are in a higher level of care right now, and kind of ask for space to talk through the weaponization of weight against you and your body, the different parts that make it really challenging for you to stand on that scale, while treatment centers figure out if this is something they actually do or do not need.
I fully like retweet that, especially because a good provider will find a way to work with you. Like if there's somebody that has, like many of us do, significant trauma around being weighed, we can get creative and figure out how we can meet that person where they are and support them as they need to be supported. And one piece that I forgot to mention as well, is that insurance companies require it for treatment. So in some ways, our hands are tied because of the larger systemic issues. But yeah, I agree, Sharon, and I'm glad that you said that, because it is really important to validate for people that like, this is a terrible experience that many of us in learner bodies have. And like, it is really hard to be told you must do this in order to access the care that you need. So,
yeah, I ended up being told ultimately it was an insurance thing at the end of the day, more than trying to figure out if anything, you know, it was awry with my weight going up or down. It is true that if you have drastic weight gain or drastic weight loss, it can be an indicator of, you know, health issues. But I think at the end of the day, it's another systemic barrier we have. And so if you are able to access treatment, you know, and wanting to stay there, how can you tolerate standing on the scale? How can you talk about, you know, what this looks like? And then how can you also equip yourself for outpatient, because life is not in treatment, right? And actually most of recovery is not done in a treatment center. It's mostly done once you are out of a higher level of care. And so how am I going to navigate scales when I see them in the future? Because all of us will. And so those are things that I would recommend in a higher level of care setting when insurance is requiring that number is put in.
I mean, all the things that you both said, and I'm so happy, Sharon, that you called that out, because I was thinking the same thing, as I hold both as a person that works in a higher level of care. The only other thing I wanted to highlight from a dietitian lens, I think very often folks think that dietitians are only focused on weight, and weight is truly, truly just a piece of the puzzle. There's so many other aspects of health and indicators, like preoccupation related to food, flexibility related to food, being able to eat with others, like so many other things that we're looking at to be like, are you taking steps to recovery at these higher and outpatient levels of care? So I just wanted to echo that, but everything Meredith and Sharon just were saying. Thanks so much.
I know that we are pretty much at time, but there was one question that and there were so many great questions that have come through. And so I'll find other opportunities for us to answer them in other weeks or send something out afterwards. But there was one question that came through, and I thought that I would be remiss if I didn't connect with it, but not sure how to word this question, but I feel like I've internalized that medical issues are impacted by weight. Perhaps not necessarily the cause of my medical issue, but at least impacted by it. Now that I'm trying to heal emotionally, how do I know when it actually is true that a medical issue would be helped by losing weight? For example, sleep apnea. Is there ever a need to lose weight for recovering from a medical issue? Should I always explore all other possible factors like stress before internalizing that I need to lose weight?
You can go ahead, Sharon.
Okay, you see me, I'm like, I don't know if either of you are jumping in first. So my personal belief and stance is that the intentional pursuit of weight loss is the antithesis to eating disorder recovery. And also when we look at the social determinants of health, which I think, I don't know which one of you talked about it, but one of you I think touched on it, might have been Meredith. Weight, how much we move our body, how much we are eating, and our actual weight is like a teeny tiny sliver of the pie that impacts our whole well-being. And so if you are someone battling an eating disorder, has a history with an eating disorder, I guess I would like pose a question, or something to consider rather, is it worth it for me to engage in intentional weight loss for maybe having better sleep apnea stuff, maybe not, because people of all sizes have sleep apnea, and then relapse into my eating disorder, and then not be able to, you know, have like, because for me, the health, the negative health outcomes of my eating disorder, were massive. Whereas now I'm at a place where and I don't personally have sleep apnea, but if I did have sleep apnea, I would choose a CPAP over personally. And I know that's not like, I'm not giving you medical advice, I'm not a doctor, but like, I would not want to put my personal recovery at risk to intentionally engage in weight loss. And I also know that for a long time, I asked questions like these while I was in higher levels of care and even in an outpatient setting, where I was almost, my eating disorder had kind of like, the urges for my eating disorder had taken the lead, where I was looking for any of my providers, and I'm not saying this is your case, I'm just speaking from my personal experience, but for any of them to collude with my eating disorder and to say, finally, it is okay now, Sharon, you can now step into a place where you can intentionally pursue weight. And I am now at a place where I know that that is absolutely not the case for me personally, where I can be in sustained in solid recovery if I am intentionally pursuing weight loss. Those two can't coexist in the same space for me personally.
Yeah, I just wanted to also validate something that I learned recently, is that sleep apnea can happen to anyone in any body, in any size. And weight loss is consistently told as the main thing from doctors that will help you. But if you're in a, straight size, thin size body, weight loss could mean even more health outcomes. So just wanting to validate that there are so many conditions that do not require weight loss that are consistently told by doctors. And I just want to say thank you all so much for taking a couple extra minutes for today. I have saved all of the questions. I will save the chat this week. Apologies about last week about forgetting to save the chat. And I will save those questions to see if there's anything we can ask them in future weeks or anything along those lines. There was some great responses and connections in the chat. And I just wanted to say there was also tons of love in the chat. I personally got sent some love for y'all about just how validating this is and how someone's going to be bringing it to their doctor's office and things like that. Sharon, thank you so much for being our lived experience speaker this week. We so appreciate you coming and just speaking about your journey and being here for others. I hope that everyone was able to relate to some aspect of your story. And thank you again also to Meredith and Hannah every week for bringing our clinical and dietitian viewpoints for this. And just thank you all so much again for another great week. We look forward to seeing you next week for media. And please feel free to connect with us if you're needing anything else. And I hope that you all have a great rest of your week. Thank you so much.
Thanks, everyone.